Depending on your philosophy of nutrition, you probably are flooded with extreme opinions on one end or the other, from carnivore diets to veganism, and very little agreement about something in between. However, thoughtful conversations need to continue to exist about the benefits of plant-forward, plant-based diets, and also the benefits of diets that do include animal products. We have many various studies that have looked at Mediterranean-style diets and others that have looked at vegetarian diets and vegan diets, and we need to continue to be open and learn from all of these approaches and to realize that nutrition is a choice. And that's one of the reasons why I was excited to have our guest, Dr. James Thompson, on with us today. And in this discussion, we have a great opportunity to learn about a transformative experience that a medical doctor, Dr. James Thompson, experienced when he was introduced to plant-forward living, plant-forward diets. And he ended up using this information to transform his clinical practice, and now his life is spent educating people on a plant-forward lifestyle. This is Dr. Adam Rindy, and this is the One Thing podcast. In this episode, we talk with Dr. Thompson about his journey with a plant-forward diet. He gives us some practical tips about implementing a plant-forward lifestyle and about the benefits that he experienced and the benefits his patients experienced. This is a great episode for anybody who is interested in learning more about eating more plants and what that might be, what that might do for your health, and also really for understanding how someone who has conventional training and is embedded in science was able to see the benefits of living this way and see actual medical changes that happen in his own life. And he was able to educate others to make those changes as well. And he's seen big improvements in things like blood sugar, weight, and metabolic concerns like cholesterol and high blood pressure. Please stay tuned at the end of the episode for a recap, and I hope you enjoy this, and please forward this to anybody that's looking to make some health changes or to inspire others to eat more plants. So without further ado, welcome to the next episode of the One Thing podcast. Dr. Thompson, thank you for being here. Welcome to the One Thing podcast.
Thank you for the invitation.
You're welcome. I'm looking forward to hearing about your journey and some of the things that you're working on. And I think first, one of the things that's really interesting to me is that you applied a lot of the things that you're currently teaching to others, to yourself. And usually that either is something that you were born with and just sort of always have been, or it was because of a personal change you went through. Can you share with us how you developed your philosophy? Was it through personal experiences, or was it from just something that you've always learned these philosophies throughout your life?
Yes, thank you for asking that. My journey to nutrition concepts or towards nutrition concepts came after several years in practice. About 15 years ago, I retired last year after 34 years of practice in allergy and immunology. I also am certified in internal medicine, board certified. But about 15 years ago, my church conducted what's called a Daniel fast. It's from the book of Daniel, the Old Testament. And the way it was designed in my church, it was for 21 days, where at 5 p.m. in the evening, the fast would be broken. So you wouldn't have anything from awakening until 5 p.m., except water. Otherwise, you'd work and go about your day. And I found that after 10 days of a 21-day fast, I was sleeping better. I had some joint aches mounting up from running on concrete. I've been a runner most of my life,
Mm.
trying to run away from medications for blood pressure and high cholesterol. And I just felt rejuvenated. And I felt by the second week it had to be more than just the prayer, because Daniel fast is really about prayer, not about when you're going to break the fast.
Hmm.
But our when we broke the fast, it was essentially a plant-based diet. That was how it was designed, and so we couldn't eat anything processed, anything that came from animal products or had involved animal meat, no fish, no caffeine, no alcohol. So by the third week, I it revealed to me that I had been missing something in all my years of practice and follow-up education called CME for doctors, because it was so focused on diagnosis and treatment, but not on nutrition, not on root causes and prevention. And that became clear to me just through that personal experience and the experience of so many members of my family that had medical problems, diabetes, hypertension ran in my family. My grandmother had strokes twice, and that's what really took her out later in life. My father had Alzheimer's. My mother had Alzheimer's and passed just a year ago. And after having it for 9 years, and my father had Lewy body dementia, much like Alzheimer's.
Hmm.
And so, but about 15 years ago, that was the shot across the bow. And so I decided then to do a deep dive into nutrition. And so I took a nutrition training course for integrative medicine, integrative nutrition medicine, and as a coach, health coach. And it really opened my eyes to what I didn't know, to the gap in knowledge that I've had all those years. Because in medical school, there's only a few hours dedicated towards nutrition. And I went to a pretty competitive medical school, and I realized that that's how many of the medical schools conducted their training. It was more focused towards pharmaceuticals, procedures, identifying diseases, and very little focus on nutrition. So I had to teach myself, and unfortunately, many of my colleagues were not quite on board, and so I felt like a loner. But I integrated this into my practice and had really great results from people. People were so unused to having a doctor ask them about what they ate and give them recommendations. So that really helped me, because I spent 25 years on three blood pressure medicines and about 10 to 12 years on a cholesterol lowering agent. And I, within 6 months, was able to shed all of the medications by just going plant-based, not eating meat and dairy, of fish, avoiding highly processed food, drinking more water, getting more sleep. So it wasn't just the diet, but I think the diet was certainly a huge part of it.
Wow, that's really interesting, and reminds me of one of my early introductions to this medicine as well was through fasting and the benefits of fasting and experiencing fasting. So I'm curious, so you mentioned two levers or shifts and main shifts in your experience of what you ate and then also the experience of fasting. So since the fasting was so profound and it did involve some prayer and other things which we'll talk about later, but I was curious what you have come to think about fasting as a practice and first maybe share about how your views have changed about fasting since that initial introduction.
Yes, well, I've looked into it more, and I do uh, exercise what's called time restricted eating, also called intermittent fasting. So I eat generally over an 8 hour window, and I try not to eat past 6 p.m. That works for me also because I have reflux and hiatal hernia. so
Okay.
so I don't need to be eating too late at night.
Yeah.
But the fasting to me is an important tool. Unfortunately, it doesn't work for everybody, and for people that are trying to lose weight, looking at studies, you get some modest weight loss. But for those that really benefit, in my opinion, and through my sitting in on conferences and research, are those that also adopt a plant-based, a plant-forward lifestyle. If you have a plant forward lifestyle and you combine that with some fasting, and there are different ways you can fast, as you know, but if you combine that with fasting, I think there's huge gain.
Yeah.
huge potential.
So, as a immunologist and allergist, you've obviously studied a lot about inflammation and how the immune system responds to food or responds to toxins or responds to allergens. What did you add in your life from this shift to plant forward and maybe this also incorporating some fasting that really shifted your physiology, do you think, from like a science perspective?
Well, I thought I was eating healthy most of my adult life. I was avoiding red meat except on occasions. I didn't eat red meat very often. Didn't eat any pork from late teenage. My father took pork away. He thought it was not a good meat to eat, and I always consumed multiple servings of fruits and vegetables. So I wasn't really eating the standard American diet, but it was very apparent I wasn't eating an adequate diet. I wasn't following an adequate diet because I still required 3 blood pressure medicines and a cholesterol agent, and I still had achy joints, and I still had headaches from time to time, all of which resolved once I went totally plant based. So it's hard to put my finger on one thing. I think it was really a combination of being able to realizing that I don't need to do the caffeine because I think that was disrupting my sleep. I think I'm a slow metabolizer of caffeine, but I was trying to stay more awake and alert during uh, educational courses and with seeing so many patients with little sleep sometimes. But I found when I went plant based, I had more energy, I had more stamina. I think it improved my clarity of thought, it improved my brain resilience. So by eating a lot more servings of fruit and vegetables, especially berries. I focused on eating, I eat a cup of berries every morning, blueberries, blackberries, strawberries. I rotate them and eating whole grains and especially engaging the cruciferous vegetables, your bok choy, your kale, your broccoli, red cabbage, collard greens. There's so many different foods out there that I like, and that's one thing I'm very proud of and happy about is that I have a broad palate. I like a lot of different foods, so I really don't miss the meat, egg, and dairy. There's so many different whole foods I can choose. But I don't think it's one thing. I think it's the combination of the greens and the beans and the berries that really help me to be able to shed the medications altogether and still have good blood pressure and great markers, in terms of lipid markers, my cholesterol. I had been on something called a torvastatin. Some people know it. Some
Yeah.
people recognize it as Lipitor for a number of years, and my cholesterol went down further than it was when I was on the medication. The last time I checked was just a month ago. My cholesterol was only 150. My total cholesterol, my LDL was well under 100. That's the bad cholesterol. That's more specifically related to cardiac disease and atherosclerosis. So those things were very encouraging to me. So I don't look back when I can see those kinds of changes, feel those kinds of changes. I wore contact lenses and corrected lenses for most of my adult life. Medical school was when it started. I was doing so much reading, and I think it just messed my eyes up. But when I went plant based, I thought I was having worse vision. It wasn't from the plant based. I just thought it was a natural progression. It was maybe about a year or so after I went plant based. I went into my eye care specialist to what I thought get stronger lenses, contact lenses and glasses, and he said that my vision had almost totally corrected.
Hmm.
I have not worn glasses in the last 8 years, like 7 or 8 years, and so many people have asked me, "Where are your glasses?"
Yeah. Yeah.
and so I attribute that to plant-based eating. All those there's something called uh, zeaxanthin, lutein and zeaxanthin that really can help your eyes. And I eat a lot of orange and yellow vegetables and green vegetables, and so I think that really I know not everybody has that experience, but I also, since I've gone to a lot of conferences, many other people have shared that their vision has improved when they've eaten plant-based.
Yeah. Makes a lot of sense with all those carotenoids, like you just mentioned, that helping those pathways. So when we talk about plant forward or plant based, I think those terms mean a lot of different things to different people. So, there's one camp that he talks about, being plant based means absolutely no animal product whatsoever, and also low fat. And then there's other camps that more are balanced with the fat intake, and maybe there is some incorporation of some animal products just as a supplement or what have you. Where do you sit on the continuum?
I convey that the more plant-based you eat, with say the far end of that being you eat no animal products, dairy, fish, the more plant-based you eat, the more you optimize your health. That's my feel, and
Mm.
that's not really a feeling. That's there's evidence for that. If you look at the Ventus 2 study at Loma Linda, California, where you have one of the blue zones. If you look at the Oxford study, I mean, there's a lot of studies that show that there's a spectrum that as you move up that spectrum and you eat more plant based, you benefit more, and with less processed food, less meat, egg, and dairy. But that said, I feel that I want to meet people where they are with things. Some people aren't ready for that, and I think even if people find themselves eating 80, 90% plant-based, but they eat 10 to 20% some form of meat or dairy, they're still going to enhance their health. They still are going to reduce their risk for many chronic diseases and cancer. So I generally want to see with people that I consult or people that I talk to, well, what are your interests here? If it's just weight loss, you don't have to be 100% meat free to lose weight.
Mhm.
If it's optimizing your health because you're concerned of the number one disease that takes people out in this country and around the world, cardiac, and you want to optimize your health, then you'll eat little to no meat because it has saturated fat and other things that we could talk about that take away from you being able to manage that in an optimal way.
Okay. Yeah. So with uh, various fads that you see come and go, where some of the messaging for a while, was heading really towards plant-based messaging, especially with the research on the microbiome and cardiovascular health and cancer reduction. But then we've suddenly seen shifts, from time to time where now the messaging is, well, we got to make sure you get enough protein because everybody's going to be losing muscle mass and atrophy, and that's the root cause of the Western diseases is loss of muscle protein. So, what do you when you see this? What How do you react to that?
Well, I try to give people some legitimate resources to go to get more information on that and convey that my interpretation of research in that area of how much protein we need has made me believe that there's plenty of protein in a plant-based lifestyle or plant-based diet, because what is protein? Protein are chains of amino acids, and these chains of amino acids you find in every plant. And so you're getting protein when you eat greens, you're getting protein when you eat fruit. It's that you're getting proportionally more protein when you eat beans and whole grains and nuts and seeds.
Hmm.
And so the last thing that's going to happen if you decide to go plant-based is that you're going to have a protein deficit.
Right.
I don't recall any as an internist, also going in hospitals, seeing people in the intensive care units, protein wasn't the issue. That's not the issue in this country, no matter what diet. I mean, there may be some people that adopt what's called the raw, the raw plant diet or raw food diet, and sometimes they don't balance it out as well, especially the fruitarian diet, only eat fruit. You might just have some calorie deficit, including protein deficit with that. But generally speaking, if you're not extreme in those areas, protein's not going to be a problem. We The average size male needs about 55, 56 grams of protein per day, and the most of these diets, Mediterranean, you name it, there's a portfolio diet, there's a number of different diets out there. You're getting more than enough protein, especially whole food plant based. If you're eating balanced, whole
Yeah.
grains, beans. So protein's not usually a problem. Women need about 10 grams less, so they're around 45 grams. Now, if you're working out, you're an elite athlete or weight trainer, or rather building up, trying to build your muscle, then you may need more because you're doing all that strenuous exercise. You may need 100 or over 100 grams, but those that aren't in that category, they generally don't. And even when you reach like I'm 67 years old, and so once you get over 50, you start, and the older you get, the more protein needs you might have. But I know I'm getting more than an adequate amount. I don't need meat for that. There's something called sarcopenia you may be at risk for as you get older because your muscles don't build as readily. But dude, you don't generally need to take extra protein. You need to make sure you have enough balance in your plate. If you're on your plate, if you're plant based, so balance, a good balance of those beans and whole grains. But protein's not usually a problem.
Okay. Do you feel that there are things in your nutrition plan that you worry you're not getting enough of?
Well, I know I need to take B12, and
Mhm.
anyone over 50 should take B12 or talk to their doctor about it because the acidity level tends to decrease a little bit as we get older, and we don't strip off that B12. Plants don't make B12, but neither do animals. And it's made from bacteria, and that's in feces and bugs and dirt. And so it really is good to consider taking B12, especially if you are plant based, especially even if you're not plant based and you're taking some medicines such for diabetes, certain medicines that are used, metformin, that is, tends to decrease your B12 absorption. If you've had gastric surgery, you likely need to take B12. If you're taking what's called H2 blocker, something like omeprazole, Prilosec, those kinds of medications that are strong acid blockers can also decrease your B12 absorption. So now many of us have combined issues. We're of age, we're taking these acid blockers, maybe on diabetes medicines such as metformin. So really, you should consider taking it and talk with your doctor about it. And it can be measured by a simple blood test.
Okay. And in my experience, I'm also concerned about omega 3, especially the EPA,
Mhm.
DHA, uh, the essential fatty acids. What's your take on that? I know there's some
Yeah.
plant based forms and to generate that, but I hear it's quite difficult to get adequate omega 3s in a plant based diet.
Well, maybe, depending on the individual. Generally speaking, though, I think most people can get adequate amounts if they focus on the combination of plant-based foods that can give you the pre-products or end products of the omega-3. For example, I do take, because of my history with both my parents having dementia, I know omega-3 is very important for preventing Alzheimer's and some other forms of dementia. I take a tablespoon of ground flax every day, and most days of the week I'm also taking a tablespoon of hemp seeds. So I put that in my oatmeal. Tastes just fine. I tend to my favorite nuts are walnuts. I have probably about a handful of walnuts every day. They have omega-3. Realize that even green leafy vegetables have omega-3. They just have small amounts, but they make up about 7% of the fat. There is fat in green leafy vegetable. I'm sorry, about, I think, 7% of the calories. I'd have to look that up. But there's omega-3 in green leafy vegetables too. So many of the foods we eat have it. It's just that we do need a significant amount of it. And I think focusing on those foods that have them may be adequate. And that's something else that can be checked. It's not on the usual panel of blood tests. You may have to advocate hard for that, but it can be checked.
Right.
But and then especially if you have risk factors, yes, I think if you listen to Dr. Dean and Aisha Shirzai, they are MDs that have dedicated their lives to preventing and managing early Alzheimer's in Loma Linda, California, and they do advocate that as a supplement. So I don't think everyone may need to take it, but there are some that may want to consider it based on their family history and their concerns.
That's great. Yeah. So what I'm hearing is it's a very individualized decision, not necessarily needed for everybody, but there's scenarios. And we do have testing that can see how well your omega 3 levels are. A test that I've heard is called Omega Check. That's a good lab test. And yeah, it's not always covered, but
Right.
it's getting more and more reasonable. So, well, that's really helpful. So I can see why you were such a popular doctor when you were in practice. You know, I remember shadowing a doctor in my community, Dr. Richard Neiman, who was a board certified rheumatologist, and he would, go through, and people were on some very serious medications, for various autoimmune conditions, and in his visits, or he'd always bring in some diet or lifestyle suggestion, and people just felt so reassured by that. Why do you think that is? I mean, I have my opinion, but I I had seen people, I don't see them react to me when I make the same suggestion, but there was something about the fact that their rheumatologist was also not only giving them their medication, but also talking about this other stuff that was sort of this powerful uh, balance of information. Can you comment on that?
Uh, yes, most people, I think, are really looking for a couple of things from doctors. They're looking for them to be good listeners. So I don't think I'm going out on a limb to assume that the doctor you're referring to was a good listener, because that's something I think a lot of doctors are deficient in. And to listen means you're asking questions and then you're pausing to let people answer. And sometimes those two things, one, asking those important questions. It may be about their food, it may be about their lifestyle, it may be about their environment, their job, their relationships. Asking those questions and then letting people respond to them without cutting them off is a major input towards leading doctors to be able to help their patients. And right now, these 15-minute segments that we have to check the boxes, and the vaccines, and do they have this test or that test, or this procedure, side effects on the medicines, doesn't tend to lend itself to having that kind of relationship with your doctor. One reason why I think, I won't say more popular, but I think I was more well received by patients compared to some of my colleagues is because as an allergist, I was trained to really spend more time with patients and going well beyond medicines and questions about that, talking about their environment, about their
Mm,
bedroom, about their workspace, about their, what's in their air, pets, things like that. And so I found that patients were more engaged with me because I asked those questions and because then I listened to those questions. And then I processed those answers in how we mapped out a treatment plan, which was always more than just take these pills.
yeah, I think that says a lot. I really want to hear more about the questions you asked and how it pertains to your your book that you've written, The Fearless Wellness. But I want to also comment on, yeah, I think the fact is that it seems as they're there and they know they have to take these medications to stabilize their condition, and nobody wants to take medication, and you're offering them more than just a prescription. You're offering them tools and tips and things that they can do that are non-medication based, that I think really brings in a humanness to the experience that is desperately needed. So I mean, uh, I think it's really great that you approached it that like that, and are inspiring other doctors. I'm sure, because I know there's more and more doctors that are moving in this direction, and you know the patients that go to those doctors are receiving someone who's walking the walk, talking the talk, and that's a very powerful way to learn from a doctor. So with introducing your process to your community and to your patient base, What was that like? Was it something that took some time? Were you met with resistance? Did you feel like you were starting from like ground zero?
Well, it was very rewarding from the very start because patients aren't used to doctors asking them about what they eat and then having comments about how to proceed. So I found that many patients, since I still had that 15 to 20-minute slot I was talking about, where you really have very little time to engage patients, but I found patients coming willing and wanting to come back to follow up for a focused discussion on those areas. Because as you already mentioned, patients don't like taking medicines. And that's kind of ironic. I mean, in a sense, it's an oxymoron because, you always hear, this is a pill taking society. People come in, they want a pill for the ill, right? but but yet what they want is a cure for the ill. They don't want some pills they're going to need to take forever, right? Or take, for weeks, months, or years. And so when you give a patient an opportunity to reduce medication over time, possibly eliminate it. We're talking people with type 2 diabetes that have maybe been on it, medicine for 10 years, people with high blood pressure like me for 25 years taking medicine. It's a revelation to them that there's a possibility that
Hmm.
they could stop this medication, that they could, and at the same time, be reducing their risks for the most common cancers, whether male or female, for male prostate cancer, colon cancer, for women breast cancer, colon cancer. At the same time, you are reducing risk for that. And at the same time, while you're eating plants, you're reducing, you know, risk for uh, other diseases, lung-related diseases. You're reducing risk for we were talking about autoimmune diseases earlier. You're reducing risk and may find that your lupus may go away. There have been people. There's a very brilliant doctor, Brooke Gardner, whose lupus was resolved by going plant-based. MS, I'm not talking about all forms, but I'm talking about more than just a few people, more than just chance, that people have turned around some very chronic, devastating diseases, not to mention dementia and Alzheimer's, by changing their diet and lifestyle. And now there's proof positive of it. Dr. Dean Ornish did a wonderful study, I think about 50 patients, and some of them having early Alzheimer's, and showed that lifestyle and diet can turn that ship around. I'm not saying cure, but I'm saying have much of a bigger effect than any medications to date have had.
Hmm. Yeah. So, I mean, some of those studies that you're talking about, I think, really give people the confidence, that making changes like this is going to lead them in the right direction. I mean, I think it sounds like you didn't have much resistance when you started sharing this, and that that's amazing because I mean, I think you know people have made comments that nutrition is like religion. It's like if you want to change someone's diet, it's like converting them to a new religion. That's
Yeah.
that's not an easy task. They have to align with it in some ways and understand it and believe it's right for them. So it's fascinating to me that you know you were able to reach people. Did Was the format that you used more just one-on-one consultations, or did you start doing other programs?
Well, both. Some people liked, and I think it's great when you have a group effort or you have someone else that's jumping in with you. Mostly it was one on one. I don't want you to get the idea, or people listening in to get the idea, that I had all these people come to me and I cured them, or that they all changed even 6 months later. I would say the majority didn't really, but a lot of them did. I have that concept where, that old fable or story where you have all these starfish that washed up on the beach, and someone drives by and sees someone throwing one back at a time and says to them, well, why are you doing this? There's just 10,000 of them. It's not going to make much of a difference. And the answer is, well, it's going to make a difference to the one you threw back in, right? To the few you threw back in. So
Yeah.
that's kind of the concept I have when I was in the office, and I have now. I don't expect everyone to just start go right home and clean out their pantry or their refrigerator. But I do want to plant seeds because I've seen that in the 8 years when I finished up my practice, there were some people that would come back 6 months, 12 months, 2 years later, and they said they've started the process. That they're grateful. They want to know more now. It just took them a while. And there are others that jump right in. There's not everyone does that. There are different personality traits that come into that formula. But I just want to plant the seed because a lot of times the seed hasn't even been planted by their primary doctors or by their other doctors. And so once you plant that seed, the soil may not be as fertile as, in one person to the next, but at least it's there. And when I have follow up appointments, I would revisit that with people. I'm like, how's it going with what we talked about last time? How's it going with your blood pressure? How's it going with your diabetes? Now I'm an allergist, and here it is. I'm really focused on their skin problems and their asthma and all that. That's what I'm supposed to be focused on. But I took it on holistically from the point when I received the training certification. I felt, well, I'm going to look at people from a holistic standpoint, not just from this one funnel vision of their asthma or food allergies or eczema. And I found that so rewarding because the side effects of going plant based, if you don't even nail what your goal is, like maybe you wanted their asthma to get better by them eliminating milk and eating more plants, and often it did get better. but say it didn't, then they're all there. I'll ask them, well, how did you find any other differences when you went plant based? And people will say, oh, I slept better, or I have more energy, or my joint pains went away. Those are wins.
Yeah.
And then I remind them too that they're reducing their risk for these cancers that many of them know. If they're middle aged, they have friends and relatives that have experienced breast cancer or prostate cancer, or different kinds of problems, kidney problems. And so even though the main focus may not be fulfilled, there's so much other things that can happen well when you make that kind of change.
Yeah. Yeah. I mean, so it's with that holistic view, you're really
Mhm.
looking at that all of this is contributing to their inflammation bucket, right?
Right,
And
right,
so if you're able to dump some inflammation, it's going to help those other conditions too. The
absolutely.
Yeah, so that's incredible. Is there any stories of anybody that comes to mind that just shocked you? You thought, okay, I'm going to introduce this to this particular patient, but it's probably not going to land well. And then they came back and shocked you and said they did what you said, and they like it. They like how they feel.
Yeah, one was a young lady that had asthma, and I was convinced that she would likely be one of these people. If she gave up dairy products, we would be able to control her asthma more and maybe reduce her medication. She was requiring lots of medication and periodic steroids during the course of the year, but she was very resistant. And, she really didn't want to give up cheese and, her occasional milkshakes and cake and things like that. So there was a couple of appointments where I reminded her of that after I initially discussed it with her, looked in her eyes and said, look, I really think you can do better different, on multiple levels, but especially on managing your asthma if you just give up the dairy. And I told her about other substitutes for that, oat milk or soy milk. And so a year passed. And I usually saw patients when their asthma was under good control twice a year. When it wasn't under such good control, I would see them 3 or 4 times a year. So I was seeing her 3 to 4 times a year, but then all of a sudden, a year passed. And, usually when that happens, you think, okay, maybe they moved. I mean, you don't know why someone disappears for a year. But she came back and she was no longer consuming dairy. And she said that she hadn't required inhalers nearly as much. So she gets a cold, she uses her inhaler. She didn't need the inhaled steroids anymore.
Yeah.
And I said, well, what made you change? And she said that she had horrible acne that would that would flare up. And when she did start to go down, she started dropping off milk products. she noticed her face cleared up,
Hmm.
and that, and so and that's not a rarity. Often, especially in young people, that and many young people have acne. About a third of high school students have pretty severe acne.
Yeah.
The face will often clear up when you get, when you shed the milk products. But that was her gateway to completely giving up dairy, and she looked great, felt great, and I was so happy for her.
Wow. That's a great story. And, it's, it's relatable too, because, usually these changes don't follow a direct line. They come through other avenues and discoveries, and the fact that it that move addressed two major problems was phenomenal, and says a lot about the influence you had on her, and how the diet was influencing her inflammation. So, well, what led you to formalize your philosophy and come up with the acronym Fearless, and how did that come to be?
Well, one thing, several years ago, about 7, 8 years ago, when I started to integrate this into my practice, I knew I didn't have much time to go over nearly what I wanted to with patients. So I created a website, and I would defer them to my website so they could get more information, more detailed information on food choices and diet, and various other non-nutritional or non-dietary measures to help bolster their journey to good health. And so I ended up, over a course of 3 years, having several blogged information, blog topics that I blogged about to help my patients. And after about 3 years, I thought, well, maybe I should put this in a book. so so then when I started thinking of it that way, because I know eventually, my stuff is just going to be somewhere in cyberspace, and I won't probably even have access to it. I had that happen years ago when I had my first website. I fell back on paying for the hosting, and I lost my
Yeah.
information. So I said I should really document this,
Yeah.
and so that's led to wanting to my desire to write a book. And then I wanted to have a name for it and some kind of model for what I was going to be advocating. And so I came up with the Fearless model, which, interestingly, since that time, American College of Lifestyle Medicine. I'm not sure if it was since that time or over the same time, but the American College of Lifestyle Medicine has 6 pillars. I just have two more than the American College of Lifestyle Medicine, but it comprises their 6 pillars.
Mm.
And so that's why the food I wanted food to be first. And so F is for food, plant-based. And my definition of plant-based, which I put in the early pages, is not vegan. It's not whole food plant-based. It's predominantly eating plant-based foods.
Mhm.
And then the E is for exercise, which is extremely important that people have regular exercise. And the A is for avoiding toxins, not just alcohol and tobacco, but those 10,000 processed food toxins that are additives that have never been studied to see if they're really that safe. And so that would be avoiding processed foods also. And then the R is for restorative sleep, which cardiologists put that as now as number 3 on the depth chart. Food, exercise, adequate rest, and most people, most adults don't get adequate rest. I think I know 7 hours, 7 to 9 hours is a hard thing to do. And then there's the L is for lessening stress. Maybe yoga, meditation, mindfulness. And then the second E is for engaging your mind, and that's where it comes in, especially people in my age group that may be at near retirement or retired. Not to just retire and go to the couch or to the golf course or to the crossword puzzles, but do things that are engaging, that are complex, that have purpose, that can keep their mind healthy. The mind needs to exercise just like the muscle, and by having complex things that you get involved with, maybe even things you do in the community, that keeps the brain healthier. And then the last two S's are for social energy. So that ties in what I was just saying. When you collaborate with someone or people for the good of others, there are hormones that go up, beneficial hormones, including serotonin, that go up, that help you heart wise, help you brain wise. And then the last S, last but not least, is spiritual connectivity. And I make it a point that doesn't mean you have to belong to a certain religion or or believe in a certain God. I mean, it just means realizing that we're grounded, that there is a higher force that you can draw on, and it can really help you, in times where you're really down. For me, it is God and prayer. But for some people, it may be something more philosophical. It may be yoga. But we need to have that existential power also that we are aware of. And under that
Excellent.
comes gratitude.
No doubt. Yeah.
Mhm.
So it's a very complete, balanced lifestyle. If someone is, say, doing one or two of these things, well, how do you frame incorporating these pillars into your life if you're really just getting started?
Well, I tell people try not to do more. Try not to do too much at once. It's very really difficult to multitask these things, and so and it's an individualized thing. If it's someone that's just had a stent placement or a cardiac stent placement, that's where they put a little material in the vessels so that it's open wide and blood can go to the heart that might be at risk, region of the heart. Then they may need to go faster. They may need to really jump in. So because once you've had a heart attack or you've had a threatening heart attack, you're at higher risk to have another one.
Yeah.
And so it depends on the individual. There may be someone that feels they're in good health but just wants to optimize it, and they may be able to take it slower, what we call baby steps. But the thing is to take steps and realize that the addition of small changes can add up to huge benefit, to improvement in outcomes. And so we take food one step at a time. It may be increasing on a daily basis, one serving. If you're already doing 2 or 3 servings of a whole food, go to 3 to 4. It may be if you're not working out at all, start walking 10 minutes a day and build on that every 2 to 4 weeks. Go up maybe 5 minutes. No one has to do an insanity workout. It's making sure you check the boxes for sleep hygiene. So those are the more important things to start out with. And then realizing that there's so much more you can do as you go along. I like people to
Yeah.
keep a journal. I think that's good to kind of document things, whether it's weight as a goal, whether it's sleep, whether it's something else fitting into a dress or fitting into some pants. There are different things. I like people to have specific goals, and they can see in 3, 4, 6 months. Have they met those goals, or are they close to it?
Hmm.
So
Very
that's
nice.
that's generally the approach.
Great. So, yeah, I mean, there's different degrees of motivation.
Mhm.
There's different uh, consequences of not following or not building this lifestyle. For some people, the consequences are staring them right in the face. And for other people, they have more time to integrate. But I like that with the goal setting, and focusing on the steps. So that's excellent. So with your work, I know you've worked a lot with the Black community, and I'm just curious your thoughts about uh, how how have your approaches been received within the Black community, and there's sort of a sense of what I've learned is a sort of mistrust in the Black community of healthcare in general, healthcare recommendations, healthcare providers. Can you talk about that and just share what you've learned over the years and where that's headed?
Sure. Yeah, I've mostly learned you have to be patient and but yet diligent and persevere in providing information, because once a person realizes that their body is designed to restore, to replenish, to heal, and that you can assist the healing by just making these changes, then it becomes much more clear that you can do this. You don't have to see yourself as a labeled, individual. Okay, I'm vegan now. Okay, I'm whole food plant based now. I'm Mediterranean. Skip that. Purely eating more of healthy food, whole food, eliminating or restricting as much as you can the highly processed food. I'm not saying processed food. Processing is just chopping something up. There's nothing wrong with a chopped up apple, you know, but highly processed food. That means when it doesn't look like what it did when it came out of the ground and something was removed from it, often nutrients like fiber and minerals and vitamins, and some things have been added to it, usually chemicals we can't pronounce. So eliminating those to the best of your ability and replacing those calories with with whole food, those are huge steps that begin to add 5 to 10 years of your life right then. No matter where you are in this journey, you could be 70
Mm.
years old. You know, you're going to add some years to your life by making these kinds of changes. So I found this very receptive, put into those terms with many people, many black people as well as others, but Hispanic people, really anyone. I mean, this we don't limit. I'm a medical director of Healthy Living with a Vision Foundation, and so that's how I spend most of my time in providing information. And so when we provide information online, it goes to anyone willing to listen. And when we do in person, it is mostly in marginalized communities of need, but they are very receptive because those are the communities that are most stricken by the most common disease, heart disease, kidney disease. Dialysis centers on every block. Right next to McDonald's and
Yeah.
and a lot of fast food places. But it's really coming to a level of awareness, and then trying to address those needs. Some we do, we probably heard the term about food deserts, and what to do about that. We found years ago in Chicago, putting Whole Foods or Trader Joe's in the inner city communities where it's more accessible is not enough, because people will still go right past those franchises to the fast food places. So it takes more than just planting Whole Foods in front of anyone. It takes a level of education, a level of being informed, and it takes people that look like the people in need to pass on some of these messages, and
Okay.
that trust.
Gotcha. So going into that just a little bit more, where has the trust been lost?
Yeah, it's kind of a complex question, but to oversimplify it's been lost along the way, going all the way back to, for black people, to slavery, because people were experimented on. Many women were experimented on without anesthesia. A guy that was later on to would be labeled as the father of gynecology, who was a main culprit, was a main perpetrator of instilling pain on a lot of women that had no choice. um, and so there's lack of trust there. There's something, Henrietta Lacks, with the use of her cells that are immortal cells to make billions of dollars, including it was used for the polio vaccine, with her family not, getting a cent until it was exposed a couple of decades ago, and still it's very modest what they've gotten from it. Of course, the Tuskegee is brought up a lot with experiment on syphilis. When long after there was an antibiotic for syphilis, multitude of black men were not treated with the drug, just to be observed to see what happens in later stages of syphilis. So when you have that in the background, that can propagate mistrust. This was stirred up a lot when vaccines came out, and I spent a lot of time talking with indigents and many black people about the use of the vaccines, and what the benefit risk. I wasn't saying you go get the vaccine. I was just saying, let's give you the information. Let's let you see there were studies that included a significant number of black people in these studies before the vaccine was released. And unfortunately, if you look at the data early on in the pandemic, more than twice as many black people were dying from COVID than white. And so the scab to me was ripped off the wound, because who is most at risk for COVID and many other devastating viruses? People that already have underlying problems, people that already have diabetes, have high cholesterol, have high blood pressure, that have debilitating diseases. And so to me, that was a direct call to action, that we need to buckle down and address these matters.
Oh, yeah, thanks for sharing that. I mean, as I'm listening to you explain things, I know my one of my takeaways for this is the importance of consent, the importance of transparency and education, of meaning explanation of the reasoning and the why and the what before someone consents to accepting care. And, you know, if that's taken away, it's hard to trust, and it seems like that's certainly an area that all healthcare needs to improve upon, is what is consent and what is patient education. But, it's really great that, underserved communities are being shared information about tools and health and lifestyle, and they're receiving it in a way that they feel empowered, and through your organization. So, and that's great to hear also that, you know this, I guess, conclusion that throwing Whole Foods in a neighborhood, or putting plant plant-based foods like in a shopping center doesn't equal success. It's a good thought, but we have a lot of other factors at play that obviously uh, will be important. It's always driven me crazy how just the food choices that are offered in underserved communities. The restaurants that plant their businesses in these communities, and there doesn't seem to be a whole lot of care about the health of the foods that are being conveniently offered. It's a business opportunity.
That's right.
So, yeah, I don't know the solution, but it's also great to see role models and folks like yourself giving people tools and education and making it more accessible, because I think a lot of people in their mind, the vegetarian or the vegan that they heard of was not who they could ever see themselves being. But if you're bringing it to a place where it's reachable and achievable, it's seems like a good recipe for success.
Mhm.
Well, what would you like us to know about what you're up to today and how people can communicate with you and follow your work?
Okay, thank you. Well, I mentioned that I'm medical director for Healthy Living with a Vision Foundation. We have a website, and you can find it at healthylivingwithavision.org to learn about our events of the past and some future events. And as I mentioned, we do some online events also, so anyone can tune in to our online events. The next one is coming up next month on low vision. And so we will be discussing that, a panel of experts, and we'll entertain some questions at the end of that. And then for those in the Chicago area, there'll be an in-person event also in October where we have a professional chef come in and do some uh, cooking class and conduct some cooking classes. And I will be giving a presentation along with two other panelists that'll be in the south suburbs of Chicago. We might be streaming that, but we haven't worked that out completely yet. My own website is fearlessmd21.com. Again, that's fearlessmd21.com. And on that website, the first thing that'll come up is my book. And so I published that book earlier this year, Fearless Wellness, and it's on Amazon. It's also in ebook form and audiobook form. So that's mostly what I'm about now, primarily working in this foundation.
Excellent. Well, thank you for sharing that, and we'll make sure that we put the links in our show notes. I'd like to conclude our visit today, which I really appreciate you doing this with me. Maybe with two things. First, if you could give your opinion about, if I had $3 or $5 in my pocket and I was in the grocery store, what should I spend that $3 to $5 on to get the healthiest and most sort of satiating meal for the day, or for at least a couple hours or 5 hours? What would you spend it on?
Yes.
Then finally, if you could leave us with some of your, maybe your your favorite or current favorite spiritual framework that helps people feel inspired in these challenging times?
Okay. Well, taking it, let's see, the first one first. So if you had $5, of course, a lot depends on what you may already have at home, but that $5 would be spent well if you eat something that is less processed, is the least processed, meaning whole food, and the most inexpensive things you can find are often like the dried goods like lentils, beans, those kind of things. Chickpeas, they're pretty inexpensive, um, and so you get in-season fruit. You can often get some in-season fruit that would be helpful. The most action-packed in terms of antioxidants and fiber are those berries. You might find those on sale. Um, but even more important, they're online. You can go from a smartphone. There's a way you can eat for $5 to $7 a day by just getting some cues online. If you put in $5 a day plant based, I'm sure that site would come up. And so educating yourself would be
Wow,
time well spent for that.
excellent.
As far as what else I refer to, there are two areas. First of all, since the Daniel fast was so impressive to me, I would say read the book of Daniel, and you'll see a very interesting story on how that came about. What Daniel did, and when he was jailed, and he ate only plant-based food, and declared that he would be brighter and smarter and have more energy than the guards, and so that was very interesting. So I'd read the book of Daniel, and I think it's Genesis 1:29 where it states that early in the Bible, Old Testament, that we're on this earth and we were surrounded by plants and trees and all these wonderful growths from the ground that God wanted us to consider as our meat, as our food, and that we had jurisdiction, that we had stewardship over the animals. I don't think that meant chasing them down and huddling them into factory farms and abusing them and eating them was the design that God had in mind. And so I would defer to that. So I would stop there.
Wonderful. That was a great way to finish. And again, thanks for being here, and appreciate you all you're doing.
Thank you. Thanks for having me.
That was an excellent opportunity to speak to with a medical doctor who personally experienced a transformation of his health through incorporating more plants and plant forward living. It's interesting to me also how he's been able to take this information and transform his community after seeing it work within practice. I think this is a perfect example of someone who remains flexible enough that they are approachable, and also he is making things achievable for people, not coming necessarily from an extreme standpoint, but he's also passionate about plant forward living. And I'm sure the people he interacts with notice that he's making it achievable. I personally have gone back and forth in my own personal journey about plant forward living, and I've dabbled in vegan diets, I've dabbled in vegetarian lifestyles, and also balanced eating like Mediterranean style, and looked at other components like Paleolithic eating styles and even ketogenic diets. I think it's my responsibility as a practitioner in this space to really keep an open mind and be agnostic about diets and really try to find out what makes the diet work for each individual. I will say that pure veganism does leave some questions that we always need to help patients understand. One of them is the levels of vitamin B12 always need to be monitored, and omega-3 status needs to constantly be checked. New concerns about protein intake and protein levels may or may not be a long-term issue, but if you've been inundated on social media about goals to eat protein that seems much more advanced or higher levels than you've ever eaten in your life, take that up with your healthcare provider and actually see if that really applies to you. And also realize that many proteins do exist in vegetables, and our concept of what a protein is may be different than what's actually true. So these nutrition approaches should really be something that's done in a way that's an experiment to see what actually makes you feel the most vital, have the most energy, sleep the best, exercise the best, think the best. And if you're checking all those boxes and your labs are looking good, then you probably have found something that aligns with your own nutrigenomics, your own ancestral connection, and nobody should judge you for that. So I hope that we continue to bring you content that you can find answers for your own journey. And I'd love for you to share if you have experienced transitions or with a vegan diet and have really benefited with plant-forward living. Please drop some comments over at our Instagram site or wherever you're listening to this podcast. Please comment and share with us your experience. Also share resources that have helped you in your journey. We'll try to share some resources in our show notes that are good vegetarian or plant-forward resources. So thank you again for tuning in, and I look forward to further episodes with you, and we'll see you next time.